You Health Aware, March is Colorectal Cancer Awareness Month, and colorectal cancer is the second most deadly form of cancer in the U.S., and it's the third most common cancer worldwide after lung and breast cancer, yet it's highly preventable with screenings. So joining us to discuss this, we have Dr. Sudha Pandit of LSU Health Shreveport. Doctor, thank you so much for joining us today.
Thanks for having me.
Let's talk a little bit about some of the risk factors of colorectal cancer.
Sure. So colorectal cancer risks, I usually categorize them on modifiable and non-modifiable risk factors. So modifiable would be your diet, such as like consumption of a high red meat and low fiber diet, and alcohol, tobacco smoking, and non-modifiable risk factors such as your comorbidities, if you have any history of inflammatory bowel disease, and if you have a radiation to your belly area, pelvic area, that also increase risk for colon cancer. And also if you have a family history of colon cancer, that's very important, or even a high risk colon polyps, personal history of breast cancer also can put you at a risk for a colon cancer as well.
What are some of the symptoms that we should be on the lookout for?
Yes, so initially, like early stage of colon cancer may not even have a symptoms, which is why it's very important to start screening on time. And the symptoms that you can see or experience is your belly pain, change in a bowel habit like constipation or alternating with diarrhea, blood in stool, weight loss, fatigue, anemia, lack of energy, those things.
So how do we begin the screening process to see if we're having some of those symptoms and we're concerned? How do we start our proactive care?
Great. So there is a guideline to start when to start for a certain individual. So for average risk individual who do not have personal history of any high risk that put them at the high risk for screening for colon cancer, then you start at age 45. But if you have a family history of colon cancer or you have other genetic risk factors, then you start earlier. And a family history, if you have family history, you start at 40 years or 10 years younger than your family member diagnosed. So basically start at 45.
So if you are diagnosed, what are some of your treatment options? Where do you go from a diagnosis?
So various treatments modality are available there. Once you are diagnosed with the colon cancer, first step is to do the staging, what stage you are with. You know, like if it's early stage, sometimes the stage 1 cancer can even be removed endoscopically, and if the lesion is larger, then obviously you go to surgery. And if you have stage 4 cancer, which is spread out of the colon into other organs, then you have to see your surgeons and medical oncologist or a cancer doctors for a chemotherapies, etc.
How often are you seeing a patient come in that may just be coming in for a screening just because it's time, but may have not exhibited any symptoms that may be diagnosed with colon cancer?
We have seen such individuals, and especially it's increasing these days in a younger individuals from like 30 to 40 and 40 to 50 years of age, is because I think the change in a diet and a lack of exercise and sedentary lifestyle is kind of increasing in the last millennials. So definitely we have seen earlier cancers in a screening population.
And we do want to reassure everyone, let's talk about the survival rate.
Survival is great. If we catch early on time, stage 1 colon cancer, the survival for 5 years, disease-free survival is up to 90%. And if it's stage 4, again, spread out cancer goes to close to 15 to 20%. But again, we have new chemotherapies, immunotherapies available now, and the survival has tremendously improved in last decades.
So let's run through some tips again. That way we can make sure that we're making the best healthy choices we can to make sure that we are upping our chances.
Absolutely. So some of the thing is, the most important and foremost thing is to start screening on time, and eating healthy diet, doing exercise, a good sleep hygiene, those are kind of paying attention to your symptoms so that we can catch early on time. And no matter what, just start screening on time. The best test is the one that gets done.
Perfect. Well, doctor, thank you so much for joining us today, and thank you for educating us and sharing with our viewers.
Absolutely, my pleasure.